So I have talked about in other sessions, I've talked about this conversation. I've been looking forward to this for quite some time. We're gonna talk about talking with your doctor, and I want to introduce to you a local doctor in my area, Dr. Stephen Tornik, and I'm gonna let him tell you a little bit, because you're a DO. And I think one thing when we are looking at our options as to who we can talk to and who we can put on our team, people don't know what that means or what's available. So can you tell us a little bit about that and tell us about yourself?
Yeah. Well, I'm a family doc in Plain City, Ohio, and I'm a sole practitioner, independent, and I'm a DO, which is a doctor of osteopathy. Osteopathic physicians, or DOs, we typically, ideally we would look at the body as a whole. You know, one condition affects the other parts of the bodies, and everything's connected. So if somebody has a mental health disorder, it may be causing your bowel problems or something along those lines, not just looking at the individual problem with your knee, for example. The thing is that we do the same things that MDs can do. It's just it should be a different approach to it. DOs, we can be surgeons, we can be a neurosurgeon, we can be a family doc like me, or whatever specialty you want. Now, there is some overlap with chiropractic medicine, and my dad was actually a chiropractor, and that's how I became interested in this type of medicine. And I saw my dad adjusting patients, all that stuff, and I was interested in. He told me about osteopathy and said, "Hey, you might want to look into this," and so we did, and here we are. But so we can adjust people's backs, we can do that kind of stuff just like chiropractor does. In fact, it was interesting because when I would come home and I would show my dad some of the osteopathic treatments that I learned, my dad would say, "Oh, that's what I've done. That's what we do." And a lot of the times they were identical. Sometimes they were a little bit different, but unfortunately nowadays, due to time constraints, insurance constraints, that kind of stuff, we don't adjust patients as much as we should. Also, unfortunately, because the osteopathic community has really blown up recently, there's just grown exponentially. There's like when I went to school, there was 12 osteopathic medical schools. I believe there's 30 something now, and that's
encouraging.
It is good, and and the other interesting thing, they're typically in rural areas, and they're because we tend to populate rural communities more than rural and underserved areas, urban areas, and such.
Yeah.
But like the typical wealthy suburb, that's not as much a DO area. Not as frequent.
Do you think that's because of the insurance access? Because I find doing natural, my natural therapies that are available, I find that the more wealthy a community gets, the worse I do at having anything bought there, because they can go to the doctor for $5 and everything is covered by insurance, so they never look outside of that.
In my opinion, I think that's true, but also I think there's the whole quick fix mentality. I think that nowadays, especially the wealthy communities, they're used to getting things
what
quickly and all that. Sometimes the natural options aren't the quickest.
Yeah.
But usually they're the best.
They're
the best.
They're going to give you much more long-term help
absolutely.
than short-term.
Yes.
So can you tell us a little bit about the history of the DO background, how it came to be?
Andrew Taylor Still, he was the first osteopathic physician, and he originally was a medical physician and an MD. And so in the mid-1800s, he was treating his kids with the treatments of the day, and they actually passed away, or some of them actually passed away. And he said that's it. Some of the treatments that they were doing at that time were like mercury infusions, which we now know, and they should have known then, that was kind of insane and probably not the best idea. But So the after his kids passed away, he said, that's it. I want nothing to do with this anymore. And then the story goes that he was distraught, and he was lying on a rope swing, and he had a severe headache from all the stress and everything. And then the rope swing was right at the occiput, and he realized that it actually took away his headache. So then he started thinking, and created manipulation techniques and all that, and to work with headaches and other ailments. And he created osteopathy. Now, and that was in the 1870s that he created osteopathy, and then in the early 1890s he made the first osteopathic medical school in Kirksville, Missouri, and it's still around today actually, and it's still open and still producing DOs. And now the interesting part about that, and the thing that I always loved, was my dad was a chiropractor, and I would hear people refer to chiropractors and DOs and pretty much anybody but an MD as a quack. And I never understood the term, because I knew it was an insult, but I never understood it. And my dad, we had a goose statue at our house because my dad was a quack. And then
you gotta own it, right? You gotta own.
Yes.
Quack mitigator, we got it.
Yeah. And so we would have duck birthday cakes. He had this shirt with a duck on it that said "Top Duck," and because he's a quack and he loved it. And so then I became a quack because I was a DO. When I graduated, I was like, Dad, that's just offensive. Why would you accept that? That's terrible. And he said, Steve, you don't understand. You don't understand the history on that. The thing is, the history, and the history we had just discussed. But Andrew Taylor Still, he created osteopathy. And around that time, Hahnemann created homeopathy, Palmer created chiropractic medicine. But it all came from the quackery, which was mercury infusions, and mercury is quicksilver, or quacksilver in German. So that's where the term comes from. So it's funny because when we're called quacks, it's like, not so fast.
Who's the quack?
Yeah, exactly. You realize that we exist because of the quackery that you guys were doing.
At that same time, and I didn't realize that the doctor of the osteopath, help me out, osteopathics,
yes,
arose up in Missouri.
Yep.
That was happening at the same time as in Ohio. Ohio is a hotbed for Western medicine and alternative practice. So homeopathy was arising up here in Cincinnati, and also the eclectics. And we had this time around the last pandemic when people were being treated with, people were aware that Western medicine had become too toxic, and there was sort of a push away from the quicksilver and all of the things that were being done. And we've got osteopathics and homeopathics. The eclectics came into being, the Thompsonians came into being, and a lot of this happened in Ohio. So we're from Ohio. We wear that with a badge of honor, but they were looking at alternative ways to look at the whole body and all the options that are available to heal and put really more of a holistic spin on it than Western medicine. Unfortunately, Western medicine got its footing back in, and we have become more reductionist and more governed by a lab result and one small thing in the body, as opposed to looking at the whole in Western medicine. Again, I believe we're back around to that moment. I love hearing that osteopathics is rising up.
See, it's very interesting also, because when we look at the mercury treatments and the theory on it, that, yes, we knew it was poisoning part of the body, but hopefully it was poisoning the bad part of the body, but allowing the good part to grow. What does that sound? I mean, that's chemo.
Yeah.
I'm not saying that people should or shouldn't have chemo, but the thing is that really just brings up some interesting thoughts.
We're back to a toxic treatment that is designed to kill, and you survive that, and hopefully it works well for you.
Sure. Yeah.
And then you have to repair the damage.
Yeah.
But I think we're definitely, I think the last 3 years, those who are watching this, the last 3 years were the last pandemic that we've been dealing with. Gosh, I hope in like 5 years, somebody watching this video is like, oh, that's ancient history. Wouldn't that be nice?
Oh, I hope.
But I think it's really bringing to light that we've gotten too toxic again, and we need to look at the holistic options.
Yeah.
I do believe that a lot of people are struggling because, and it's got to have been like that in the 1800s. A lot of people were becoming demystified with this uber authority of the Western medical model, which has a lot for it. I mean, it's battlefield medicine. It stops us from dying in critical cases, but it's not a day-to-day health thing. So I think a lot of people have lost the ability to go into a doctor's office and know how to work with somebody who has this skill and this knowledge. And so what would you say is, like, if we're going to talk about interviewing somebody to care for our family or ourselves, what are some of the things that you would look for or tell somebody to look for?
I think, probably the best thing you can do is, if you have a family member or friend that refers you there, that they've already been there, so you kind of already have an idea. That's huge. The other thing is, a lot of doctors and unfortunately a lot of hospital systems, which most are connected with, it's all about protocol, and I call it algorithmic medicine, which I understand it to some extent, but a lot of times we get a little overboard on that.
Mm-hmm.
So if you ask questions about certain things, or whatever topic you want, and the reaction is very negative, they maybe get mad at you or anything like that, just because you had a question. Like right now, the COVID shot is controversial. And if you go into your doctor's office, a lot of people, if they went in and started asking specific questions, some docs would say, okay, yeah, I hear your concerns. Now, here's my viewpoint on it, and and then we talk about it a little bit. Oftentimes nowadays, we'll say, I don't know why you're asking that. This is absolutely absurd. Why
it's
you're asking?
unquestionable.
Yeah, I mean, I said it's safe. Just do it. Reactions more like that are a huge red flag. In my opinion, get out.
Yeah.
And the other thing, as far as this is kind of a tough one. This is my personal opinion, and this isn't 100%. But if you go into the office and you see just drug rep posters everywhere, that's oftentimes not a good sign. And because it's medicines. Yes, medicines are great in some circumstances, but medicines aren't the cure-all. There's a time and a place for them, but just because you walked in the door, that's not a good enough reason to give you medicine.
Yeah, if it's reading like an ad, if it's reading like an ad that you should, or ask your doctor about this, you might be a good candidate for it.
Yes.
I found, and I've been burnt in a lot of different medical offices, and sometimes it was a good doctor that was inside the office, but the gatekeepers, the people at the front desk, were frightening. And they have really tight relationships with those drug reps. They're sort of this gatekeeper situation, and I feel like we left a practice not because the doctor wasn't reasonable or she listened to us, she worked with us, and I didn't have any issues with her, but her office staff was very militant. And I think that in these days, it's probably another good sign that you gotta go.
See, another thing that I think is pretty important is if you go into a doctor's office and if you say, hey, I'm interested in using these natural remedies or dietary changes, that kind of stuff, would you work with me in those in that situation? Would you do labs to make sure I'm doing everything okay, that I'm not deficient in certain areas, and if they have a negative reaction, say no, you'll do what I tell you to do, or something along. Obviously, in that case, get out of there.
Another red flag.
And, yes, and then but if they say of course, of course we can work together, and I'm here for you.
I think because of our litigious society and the overreach of insurance, it's rare to find a practitioner that will say to you, if you come in and you say, I want to use turmeric every day, for that practitioner to go, I don't know everything about turmeric. Let me look that up and let me look at your medication and see. Like, that to me is the big, it's a really strange thing, but it's a big it's a big moment for me that this is a safe place when somebody tells me, I don't know, let me go look, or let me ask my colleagues, or let me do the research. And I think there's a lot of doctors maybe that are afraid, their hands are so tied.
Sure.
Do you have to go to somebody that's independent, that isn't tucked up underneath all that bureaucracy, do you think?
I think the problem is there's not many independents anymore. I don't think there are.
Hard.
I mean,
It's
there's
hard.
me, and that's about it.
Yeah.
So which is really unfortunate, because a lot of times people do kind of have to agree with what the corporation says, which, that's okay, but there's ways around that too, though, to some extent, with some docs. Now, the thing is that if a doc isn't willing to, admit that, hey, we don't know certain things or whatever, that can be a bit of a problem. And, that's not necessarily 100% that's a red flag, but that could be a major issue.
Yeah.
Depending on the severity and what we're talking about.
Well, I think strong opinions, and we can't get that mixed up. Like, a doctor that's part of your team that has a really strong opinion about you using this medication or doing this therapy, but is willing to have space for you to make your own decision. Strong opinions aren't necessarily a bad thing.
Yeah.
Somebody who really cares about his opinion
Yes.
or her opinion is a good person to have on your team.
Yes.
But it's gotta be that room for, like, well, I'm gonna put this here. I really care about it. I really want you to pay attention, but
Yes.
it's still your body.
Sure.
And I will still help you when you totally mess it up.
Yes. Yeah. Hey, and that's okay. And, as a doc, just not being judgmental. I had somebody in late last week who she was in, and she wanted to try some things naturally, and frankly, she didn't do it quite right, and it caused some issues.
Mm-hmm.
So the doc, she went in and saw the doc at the time, and he started yelling at her. You see, I told you this would happen, and okay, that's wrong.
Yeah.
That's terrible. It's it's perfectly reasonable to have different views of the world.
Yeah.
People may not agree with me, but it's perfectly reasonable.
Yeah.
And same goes with medicine. Same goes with politics. Same goes with a little bit of everything right now.
Yeah, it's exhausting.
Yes.
I think to that point too, I feel like it's a two-way street. I don't feel like it. It is a two-way street. So I think that a lot of doctors have gotten really frustrated, and they've been pushed into a corner where they've watched people not taking care of themselves, not in the driver's seat of their bodies, not taking responsibility, and then coming to them when the wheels fall off. And it's gotta be really frustrating. So what are the things that we can definitely look for red flags in the doctor, but what are the red flags in us that are part of the problem?
I guess I don't understand the question.
Like, what are the things that we can do to be a good patient, I guess is a better way to put that. How can we communicate if we want to try? If we want to try something.
Don't ask questions. Just
There we go. All done.
No, I'm kidding, of course. And, but no, I think several different things. The docs, a lot of times, we're busy and all that stuff. So sometimes we just need to, pin them down. So, the docs, if we were, well, actually, I want to rephrase my thought. So here, can you ask the question one more time? Because I want to make sure I'm...
Yes. What can we do? So identifying that that's a two-way street.
Yes.
Getting that the doctor needs to do their part, but we do too. We have to come in, like, like for instance, I'm a patient and I've been secretly dosing myself with red clover constantly, but you also know that I need blood thinner, and so I'm on a blood thinner, but I haven't told you that I'm using red clover every day, and red clover is not a safe thing to take with blood thinner. So some of those things that we can be as a good patient so that we don't frustrate the person who's trying to care for us. Communication.
I think a few different things. I mean, of course, you got to be honest. And frankly, I've had several patients not be honest with me because they didn't want me to know, they were embarrassed, or they felt I would report them to the law. Like people if they were smoking marijuana or something like that. I'm not saying it's good or bad, I just need to know it.
Yeah.
Because what if it does interact with these medicines? I mean, I'm not calling the police or whatever, but none of my business. And so that's one big thing. The other thing that, as a physician, sometimes it gets kind of difficult. We do this all day, every day. So a lot of times we have like a routine that we go through. Sometimes I find that there's a lot of times when sometimes patients, they kind of steamroll me with talking, and they don't let me get a word in, and sometimes I kind of need to ask certain questions. I need some clarification, but I can't get a word in. And which is, I'm not saying you should just let the doctor take over. You should definitely be talking. But on the other hand, let us talk a little bit too.
You're there for their input.
Yeah, and that's not always the case though, but it's, it makes things extra confusing and extra difficult. And then as we never get a chance to ask those certain questions, that's unusual. But the other thing, I would definitely make lists. You always hear that, but lists are very important. Number one, just read them out. You don't need to hide them or anything like that. I mean, frankly, when people come in with them, great, okay, and I can just go through them. Okay, did we cover everything on your list? Okay, great.
That's a great idea.
It's very helpful for all of us. Now, of course, it gets a little frustrating when somebody gets a scroll that, it just we are constrained.
Maybe they need some multiple.
Yeah, which understand that sometimes, we may say, hey, you got a long list, let's address these top things, and then we might have to bring you back for those. Hey, fine, so, try and understand where we're coming from too. A lot of times physicians, I'm very blessed that I don't have to deal with this, or it's very rare, but doctors, for the most part, have to deal with the vast majority of their patients not caring.
Yeah.
They don't care. I'm not going to eat any better. Just give me the pill.
Yep.
Why? Just banging our head against the wall is very, very frustrating. But, and we're coming from a different, or a lot of times, a lot of docs are dealing with that and just not even used to people saying, well, what can I do to help my own health?
Right.
It's foreign to a lot of them.
Yeah.
And I'm very blessed. I typically am the exact opposite. Where the patients I see, they want to get better.
Yeah.
And don't go in with a pre-planned treatment necessarily. Because
don't go in with the drug you saw on the TV last night.
Yes. Now, if you want to ask about it, fine, whatever. Yeah. But on the other hand, it's not necessarily the right thing because it was on the news, or it was on TV.
I think too, being okay with the fact that sometimes the answer is, I can't do anything for you. Rest, hydrate.
Yes.
Monitor and keep me in the loop is sometimes the best care that there is.
It is, and it's interesting because I've had people say, well, why did I pay to come in here? I didn't even get anything from it.
Because you need somebody to.
Well, first of all, you did get
be in it with you.
We just told you you're going to be fine. Mm-hmm. You need to do this. You'll be okay.
Yeah.
You don't have a gigantic ear tumor or something, and so there is benefit to knowing that, hey, you're going to be fine and you don't need a medicine.
It doesn't have to be an ER episode every time you go to the doctor.
Yes,
It's
exactly.
not the rarest thing that's ever happened that's going on with you.
Yes.
Sometimes it's just an achy elbow.
Sometimes, yes. Yes. Never seen just an achy elbow. No, I'm kidding.
Never. No, I like the idea of the list. I think that's a really good way to keep your thoughts together to go into a doctor. I see a lot. For me, my personal experience with, I was in the fertility industry before I fixed myself to have the kids, and I was taking data in on myself, and this is something that I tell the people that study with me is keep your own data and go in. That's actually now a red flag for me, that if I bring data in for my doctor to see, and they don't want to see it, or they think it's silly, that's another big red flag.
Sure.
To keep information on yourself. I think of my grandparents, and they would, their age group would go into a doctor and lay down on the table and be like, fix me.
Yes.
And well, what kind of symptoms have you been seeing? I don't know, just you know. you know.
Yeah.
Well, you have to go in and give a doctor something. You have to be keeping some track and take some responsibility, and give some case information. So,
You know, I got a fun story about that. I had this guy come in who I'd seen for several years, and he was in his mid-90s. And one day he came in and I said, so what are you here for? And he said, I didn't eat my oats. He said, what? You didn't eat your oats? I said, yeah, I didn't eat my oats. I said, okay, so what are you here for? He said, I didn't eat my oats. I said, so that we kept going back and forth, and I'm like,
more information.
What is happening here? And then I said, okay, why didn't you eat your oats? He said, I don't know, I just didn't eat my oats. What are you talking about? And then eventually, after we talked a little bit more, it came out that he's had oatmeal every single day of his life, and he woke up this morning and he didn't want to have oatmeal. So, which was of such huge concern to him, he came in. Well, the interesting thing, because on the physical exam and stuff, when I just randomly started checking things, turns out he had a stroke.
Oh, wow.
Which was very interesting, because I would have never, ever fathomed that we would have got to that point from, I didn't eat my oats.
Yeah, that's...
But,
wow.
Through, some other things that happened after that, it's like, oh, I see. But it was very interesting. But it would have been a lot easier if they just told me, hey, my body's numb on one side.
Right, I don't feel well,
Yes.
and I can't make words out.
Yes.
Yeah. I think that's got to be easier. Of course, what this summit is completely about is people taking charge. And I know that there's definitely going to be physicians, there have been physicians that are very threatened by patients that come in and want to be in charge of their body. I think there's probably good ways to go about that and bad ways to go about that in a physician's office. A good physician needs to meet a good patient, somebody who's doing that appropriately and not being aggressive about taking control of their body and then coming in to see you.
Yes, I think, yeah, that's a good point. I think a lot of docs, if you come at them really strong and that, hey, I'm doing this, we're going to do this, they get
Why are
a little
you here?
upset.
Yeah.
Listen, I'm here for your lab report or medicine that I need. No, they get a little irritated about that, and then which I get, I understand. A lot of times, if there are things that you want to either do, consider ordering this test or that test. A lot of times I think I would like if somebody just presented it as like okay, so I was thinking that we should maybe consider an MRI of my brain. Here's the reason that I think we should, and I have these symptoms, it sounds like that would be reasonable to me, and there's no radiation. The cost I'm not concerned about for this reason, that reason. And so you just lay out a risk-benefit thing, and then they say, well, yeah, good point. Okay, let's just order it. And so if you present it in a way laying out things where how can you possibly argue it, but also not overly aggressive, being respectful to them, and also listening to what they say. If they say, no, that's why would I order an MRI of your brain if you twisted your ankle? That has nothing to do with it. And then now if you lay it out a good case for them, okay.
I twisted my ankle because I've had lots of weakness in my
exactly. I'm having numbness on the rest of my body, and
Yeah.
I'm having ataxia, and I got lightheaded and fell over. Okay, that's a different story, but you need to tell me this. So just present it in a a nice, calm way, not too aggressive, and so.
It seems to me that if you were to make a relationship with a doctor up front, that you've interviewed them. Once you've interviewed them and hired them, now you have to trust them because you made the decision to go in.
Sure.
It's when we're so accustomed to going in blindly and hoping that this doesn't turn out to be a bad relationship. We don't do that anywhere else. Like, we're not like, I'm gonna make a friendship with this mass murderer and I hope that someday he doesn't kill me. Like,
Sure.
There's tension in that relationship. If you've hired somebody, then you've got to work with them, and that relationship doesn't have reservation on either side. You'd be a lot more.
Sure.
Finding you guys is hard.
Yes.
It's hard.
One other thing that I can see being a huge problem for people is if you've seen the same doc for a billion years, and then you're just kind of getting the feeling that, hey, this isn't quite how it was. We see that all the time, especially when there's like an independent doc who gets bought out by a hospital system, and then now they have to go through all these protocols or see X amount of patients per day or whatever, so things change, and that's okay. And even though sometimes you have a close relationship with them, if it's not right, it's not right. If you gotta go, that's okay.
It's okay to fire
because just
your doctor.
You being having a relationship, but with the doctor, but having poor health care. I'd rather you have just better health care, and sometimes even the doctor knows it too. That hey, they aren't able to provide the appropriate care because of some of the requirements that are put on them, but it's okay.
It sounds a lot like relationships that we have when we're teenagers, like learning how to break up effectively.
Medicine is high school.
Learning, I can see that now. I hadn't seen it before, but learning how to appropriately pick your relationships, end them when they're no longer serving you, so that both sides can go on and be healthy. It's the same in medicine.
And ultimately, I think maybe there was a misunderstanding, or maybe I see things differently, but the patient's the boss. I'm not the boss. I'm basically a consultant. And you come to me and you're presenting certain ailments and asking me how to treat them, and I give you my opinion. And if you decide not to follow that, that's okay. But I guess jumping way back to the red flags and stuff, one thing that's kind of a red flag to me is that if I as a physician make a recommendation to you and then you go home and you don't do it, and then you come back and I'm livid about it. Hey, you know what? I made my recommendation on what I feel is the right thing to do. If you choose not to do it, so be it.
Yeah.
As long as I did my job properly presenting it to you,
You
thoroughly
did your job
presenting it.
as the consultant.
Okay.
Yeah, and then somebody's going to make their own decision, and if it's the wrong decision, they're going to pay those consequences.
Yeah.
And that's going to suck, but it is what it is. Wow. Yeah. So, is there anything else that you can think of that we would want to think about in this relationship?
Don't just go to an insurance company that your insurance company tries to make you go to.
Oh, that's a good one.
Because a lot of times they automatically sign you up for ones, put so-and-so's name on the card. I've had people come to me because of that.
Yeah.
And that's not right.
Research.
And,
Research your caregiver, because it's
Absolutely.
everything. It's everything. You're going to create a relationship with somebody who is, and it should be a give and take.
Sure.
And as a patient, it's your responsibility to go home and take care of this and talk with your doctor. And
Sure.
if you don't do your end, the doctor isn't a miracle worker. They aren't just magically making you well. The advice needs to meet somebody who's willing to do the work for a truly successful situation. Well, thank you so much for your time.
Sure.
This has been awesome. It's made me think about a lot of things I haven't thought about, and I know it's going to be really useful. So thanks for joining us.